So the story with Fedratinib continues to evolve, and obviously this is the second approved JAK inhibitor in the field of myelofibrosis, and it's approved both first and second line, and there is evolving data with the Freedom study. So Freedom 1 is now complete, and we've seen some data presented from that with regard to reassuring information for management of gastrointestinal toxicity and just reinforcing the need to be careful with nutrition for our patients and thiamine. So that data is important, and we should expect some top-level data from that study, hopefully at ASH this year. So a call out to that, look out for that. And then I think the newer data really helps us to address this question about where is it going to sit in the field? Where are we as clinicians going to think about it? Where our patients want to think about it? So there's now some real world analysis as patients in the real world outside of clinical trials are having access to this medication. One showing that actually outcome in terms of spleen and symptom responses as measured in the real world setting appears to be good. And two, there is some data from several hundred patients actually suggesting that survival is not impacted and may actually also be improved with Fedratinib. So reassuring data. I still think most people are probably using this agent in the second line setting, but we do know that it's effective, perhaps a little bit more effective for patients with big spleens and or platelets between 50 and 100. So more data coming, but the evolving picture looks very stable and steady.